Oh, did I tell you there was a quiz after this for this? Can you imagine? It's probably more than in a class. Okay, this pie chart shows that 14% of Larimer's elders live in rural areas. Does that jive with your, is that what you believe to be true? Okay, I'll take that as a yes. The language spoken at home can indicate service needs among elders. While small percentages of elders speak a language other than English in Larimer County, it's critical to provide services and information and help in other key languages in a community. That would be one thing to do, is to identify, and I know that's being done here, but it costs money to create materials and public relations and outreach in a variety of languages. Acknowledging an area's diversity and creating programs that serve all is the intent of the Older Americans Act, one intent. This term, increasing minority participation, is something I've heard for 30 years, but it's been a long-time goal of the National Aging Network. How can we increase participation by minorities? This pie shows that Larimer County only has 2% of the state's minority age 60 and over population. So it's a very small percentage of the state's minority seniors live here. Larimer's 2,312 minority elders represent just 5% of the county's older population. So 5 of every 100 Larimer seniors are considered minority. This is one where you certainly do need to take it with a grain of salt. It's self-report information usually, and sometimes it's confusing. This is another chart from the 2004 Strengths and Needs Assessment. And what it shows is that while 2/3 of Larimer's elders reported no disability when we did the study, over 1/3 report one or more disabling conditions. Right now, one thing that's being done is there's scenarios being developed if we have major disability happen, moderate levels or lower levels. But even under the most optimistic scenario where disability falls, let's say, because people are taking care of themselves, medicine, the size of the disabled older population is going to grow by more than 50% between 2000 and 2040. So this is another thing to keep in mind. While many midlife and older adults find themselves providing significant help and care to grandchildren, I should start over, many midlife and older adults find themselves providing help. Lots of grandparenting going on. In Larimer County, 48% of grandparents surveyed in 2003 reported being responsible for their grandchildren's basic needs for some period of time. That's pretty significant. Grandparents are doing a lot here. Among older adults in Larimer at last census, 2000, this is what the educational attainment picture looked like. What this shows is highest level of education attained among older people, and this is age 65 and over, and the largest category that Larimer had were people with a high school diploma. But you have significant numbers of people who are older with a bachelor's degree and a graduate degree. 13% at that time of seniors said they had a graduate degree. Almost 16% said they had a bachelor's degree. And one thing we do know, higher education correlates with higher lifetime earnings. Paid employment, we cannot forget that, even though we're talking about older people. Sometimes you look at charts and they don't even look at seniors, but paid employment is critical and becoming more so. It's one of the most important and growing issues in our aging communities. More older adults are saying they are working primarily due to economic need. This data shows the 2000 census information, but based on the recent American Community Survey done in 2000 to 2006, the median income of Larimer households was about $56,000. So the data up here shows it was probably from actually 1999 data in 2000. You can see that the highest household income is for the group age 45 to 64. And then it goes down as people get older. This shows poverty level information. We use the federal poverty guidelines for lots of discussions, but the federal poverty levels are really quite low. How many of you use the poverty levels and agree with me that they're really low? And okay. Larimer has 4% of the state's below poverty level elders. But let me tell you what the poverty level is. In 2009, for one person, poverty was annually $10,830. For two people household, the poverty line was $14,570. So when you say a lot of programs provide services to people below poverty, those are the levels we're talking about. In my mind, I even double those, 200% of poverty, and it's still not enough to live on in most cases. I want to make sure I have the same one up. Yeah. Of all elders that live in Larimer County, 5% lived at or below the poverty line in 2008. That was about 2,300 seniors. So 2,300 seniors are living at $11,000 a year or less. In this case, the pie chart shows that 19% of Larimer's elders live at or below 185% of poverty. Some programs serve people up to 185%, some 200, some 300%. We're still talking $20,000 a year for one person at 185% of poverty. A lot of these people are called near poor, and many near poor seniors do not qualify for many programs. I've seen the information from your Partners Past Poverty project here. They've been tracking poverty statistics, which I think is fantastic. So congratulations on that. But based on this information that I'm showing you here, and I'm citing Bob Moore. Is Bob here? Okay, from the Fort Collins, Colorado end, because I use some of the information that he put together to show poverty information. Based on this information, Larimer's overall poverty rate increased, overall, all ages, by 38.8% since 2000. But guess what? The poverty rate was twice that for seniors. It grew at double the rate. The senior poverty rate grew by 85%. This has translated, just ask service providers, into huge increases in the number of older people asking for help. And I'm wondering, do I get 5 more minutes? 4, 3? Okay. We need to pay attention to living arrangements because older people living alone often experience more problems than those living with others, though not always. Women are more likely to live alone in later life. And Janice Blanchard is going to discuss a little bit later today about how bringing people together in communities is increasingly being touted as a model for addressing the problems of aging. And I believe Phil also discussed that to some degree. In Larimer County, 1 out of 5 elders is a woman who lives alone. 2/3 of Larimer's elders live in family households, which I think is good. It's a good thing. Quickly, high percentages of Larimer's elders own their own homes. This is good for stability and security, but the cost to maintain an entire home can be staggering, which we heard earlier. And the need for affordable home repair, like Phil said, and home modification services, this is often the top unmet need reported by older residents. So let's talk about healthcare very quickly because you'll hear more later. The vast majority of older Larimer County residents said they had seen a regular doctor in the past year. But guess what? They're less apt to see a doctor for eye, hearing, dental, and even physical exams. Regular exams are not happening as often as just a visit to the doctor.